Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Positive and Negative Syndrome scale assesses the symptom severity in patients with schizophrenia. It evaluates positive symptoms such as hallucinations and delusions, negative symptoms including social withdrawal and blunted affect, and general psychopathology. The main purpose is to provide a comprehensive measure of symptomatology to guide clinical treatment and monitor changes over time. This scale assists clinicians in differentiating symptom domains and evaluating response to antipsychotic therapy. The Positive and Negative Syndrome scale is indicated primarily for patients diagnosed with schizophrenia. It is used to assess the severity of positive symptoms such as hallucinations and delusions, negative symptoms including social withdrawal and blunted affect, and general psychopathology. The scale is most useful in clinical trials, psychiatric evaluations, and treatment monitoring to objectively measure symptom changes over time. It aids clinicians in tailoring interventions and evaluating therapeutic efficacy. The scale's reliability and validity have been established in adult populations with schizophrenia and related psychotic disorders. The Positive and Negative Syndrome scale consists of 30 items divided into 3 subscales: positive symptoms, negative symptoms, and general psychopathology. Each item is rated based on a semi-structured clinical interview using a 7-point Likert scale ranging from 1, indicating absence of symptoms, to 7, reflecting extreme severity. The clinician asks standardized questions targeting hallucinations, delusions, emotional withdrawal, blunted affect, and related symptoms. After rating each item, scores are summed within subscales and across all items to generate total scores. Interpretation relies on comparing individual scores to established reference ranges. Typical clinical thresholds indicate that positive and negative subscale scores above 25 suggest moderate symptom severity, while total scores exceeding 75 denote marked symptomatology. Scores close to 30 or below on individual subscales usually reflect minimal symptom presence. The scale's structured format and numeric scoring provide quantitative data to monitor symptom progression and treatment response over time. The Positive and Negative Syndrome scale demonstrates variable sensitivity and specificity depending on the clinical context and cutoff scores utilized. Sensitivity refers to the scale's ability to correctly identify patients with schizophrenia exhibiting psychotic symptoms. Specificity indicates the tool's capacity to correctly exclude individuals without the disorder. Studies report sensitivity values ranging from 0.8 to 0.9 for detecting active psychosis, indicating that 80 to 90% of true cases are accurately identified. Specificity values vary between 0.7 and 0.85, reflecting that 70 to 85% of non-affected individuals are correctly classified. For example, a sensitivity of 0.85 implies that 15% of patients with symptoms may not be detected by the scale, while a specificity of 0.8 means that 20% of healthy individuals might be falsely identified as having symptoms. These metrics guide clinicians in interpreting positive and negative syndrome scale results, balancing the risk of false negatives and false positives in diagnosis and treatment planning. The Positive and Negative Syndrome scale was developed in the late 1980s by Kay and colleagues as a comprehensive instrument designed to measure symptom severity in schizophrenia. Its initial validation involved a cohort of over 100 patients, with findings demonstrating high inter-rater reliability and internal consistency, where Cronbach's alpha values generally exceeded 0.75 for each subscale. Subsequent studies have confirmed the scale's construct validity through factor analyses, often identifying 3 to 5 distinct symptom dimensions consistent with positive, negative, and general psychopathology domains. Test-retest reliability has also been established, with correlation coefficients frequently reported above 0.8 over periods ranging from 1 week to 1 month. Furthermore, the scale's sensitivity to clinical change has been supported by its ability to detect symptom improvement or deterioration in response to pharmacological treatment, making it a valuable tool for both clinical trials and routine psychiatric assessment. Cross-cultural validations conducted in diverse populations have reinforced its robustness and applicability internationally, with psychometric properties remaining stable across different languages and settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.